And we're recording.
If we're ready to go, I'll call the meeting to order. First item of business is to approve the minutes. I'll entertain a motion.
So moved.
Motion by CA, second by Mr. Ed. All in favor say aye.
Aye.
They approved. We're getting ready for the financial. I'll turn it over to you, Tim.
Okay, let me crank it up. It went to sleep on me. Okay, let's start. Again, these are the June financials. We weren't able to get the July financials complete because of some audit stuff that hadn't been finalized. We can't start, am I saying this right? Can't start July, transfer over to July.
Yeah, the auditors came late and we did it all via email, the whole audit. So it took a little bit longer and a little more complicated, and so it took us a little bit longer to start rolling over into the next fiscal year.
You probably don't even have to find out it was longer than that.
It's
So
been
we'll hopefully have that ready in August, in September. So if you go to the second green sheet down the bottom, line 98, for the month of June, we ended up $53,746 in positive net cash flow. Year to date, $241,300 compared to $446,000 negative cash flow last year. And cash, if I'm not mistaken, that negative cash flow was driven by that adjustment we made.
that mortality rate
Yeah.
table, pension adjustment was, yeah.
Right.
Large.
So we ended up the year with $241,000 positive cash flow. If you'll go to the next page, page 3 of the green sheet that shows stats, operating stats, I'll get there. For the month, our revenue less power cost was $375,000 compared to last year, $285,000. Year to date, our revenue less power cost was $3,474,000 versus $3,456,000. $3,747,000 versus $3,456,000. So about $300,000 increase this year compared to last year. The sales for June were up, depending on what class you work. If you look at our heating degree days, cooling degrees, June of 20 had 603 cooling degree days versus June of last year, 423. And so we were 43% warmer this June compared to the month before. I'm sorry, yeah, June. I got June, July up there. I'm sorry. Well, anyway, it was warmer. So we know that. I apologize. I thought, where's my May, June numbers? We ended up the month, our residential sales were up 5%. Year to date, overall, they were down 1.7 compared to last year. Small commercial is still down a little bit. It's not all there. Most everybody's back up and operating. There's a few that's not. Large commercial is up 4.3, pretty much even compared to last year. For the year, we were 4%, 0.4% under last year's kilowatt hour sales. So large commercial kind of kept us going during this COVID thing, because none of the big companies actually slowed down. Our wholesale power cost, or what we bought TV, was down 0.5% compared to last year. And if you notice here, our losses, last month our losses was up quite a bit. This month they're negative, so again, since that reporting cycle, our losses year to date are actually down compared to last year. So it turned out to be a pretty good year for us in the TVA report. Any questions about anything in particular on the TVA monthly report? If not, we'll go to the budget. The budget was all fine and dandy. They had no comments over anything on the budget. Let me find it here. The actual cash position in the month of June was $149,449 to the good. We had budgeted a loss, but that had to do when we paid our insurance, our building insurance, right? $135,000. We had it budgeted for 8th May, and we actually paid for it in June or something like that. So that's what drove that number right there. So we ended up $149,000 good year to date, a little over $1 million positive cash position. We budgeted to be $600,000 positive cash. If you look at the totals here, we can kind of see where that $400,000 came from. We were $939,000 under sales budget versus actual. But at the same time, we were $1.3 million under on wholesale power costs. So that's about $70,000 difference there. We didn't have the insurance. We ended up low for the year on the insurance, and we normally do, but this is the closest miss we've had. Normally it's a bigger miss than that.
Why is that now?
Not everybody gets sick. We calculate everybody's gonna get sick up to whatever our experience ratio is.
Okay.
And we use like 52%, 51. And every year when we calculate the insurance and bring it to y'all for whatever, we go back and look at the actual, how much money we spent on our flex.
Gotcha.
We
Okay.
have to budget that everybody's gonna get sick.
Right, okay.
But not everybody does. Well, we don't actually budget everybody. I'll take like 52, 55% of everybody,
Right.
based on what the last year's actual was.
And what's the difference on the other revenue?
Other revenue, can't be able to help me with that. You talking about for the year,
No, it's the one.
for June? You talking about this forfeit discount line 94?
No.
Other revenue, other income, I'm sorry.
Oh, other income.
Under other revenue, but line item 98.
That other income is interest earned on or deposits. What all's in that line, Kathy? What's that?
It should be on there.
All right.
There it is.
Are we talking about the $334?
The 1930.
1930,
Yeah, we're looking at on
98.
first page, other income line 98. Go past the month and year to date.
Under operating, under June.
All right, at the very top, you got your operating income, Keith. The top left corner says operating income. And you go down the page to line 98, says other income. Here.
Oh, we on that.
We're on the
We
budget.
budgeted 3,300, and we actually did 1,370.
And that's just basically, you had budgeted for more
Now-
money and you didn't.
If I not
Now,
got
some of
yours
that
correct,
is, if I'm not mistaken, some of that's gonna be when we sold trucks,
other income, income.
when we sold those three
Okay.
pickup trucks.
Okay, what you anticipated and the difference in what you got.
Right,
Okay.
right.
But we did get more than that.
Right, we did, but there's
Surprisingly.
several things like that that are also in that
Okay.
98. Those gonna be the biggest chunk of it, is gonna be those.
But it's just based on what you had anticipated and.
Right, like if we knew, yeah, if we know we're gonna do something, then we're gonna, increase that number. If not, normally we don't put a whole lot in
Right,
that account.
That's, I guess that's probably.
And you bring up a good point, Mary, over here. If you look at forfeited discounts for the year, we're $26,000 down. In 2 months, we didn't charge late
Right.
fees. That drove that. Miscellaneous services up, that's when we go out and do jobbing, somebody breaks a pole or wants us to move a line. That's in there. Rent from electric property is our pole attachment agreements. Then other income most of that is interest income, the things we get off of money market.
Well, and that's where like our trucks and stuff like that, anything we sell.
Oh, yeah, and that shows up as a negative number, right. Okay. So we see all that. Any questions about the June budget? If not, I'll ask for a motion to approve the June financials.
Second.
Motion by Christie, second by C.M. All in favor, say aye.
Aye.
Motion carries.
Okay, I did hear back. I called Seth and passed on to him y'all's desire to look at $100,000 rate reduction. And I know he runs some preliminary numbers based on just doing across the board kilowatt hours or reducing demand and other things. See, this is what I'm thinking. He looked at it, he sent back 2 recommendations. I got them summarized in your packet, and we'll go over them up here in detail. So let me find it. Let's go to the rate reduction. Option number 1 is where we'll start at. So it says in red at the top of the page, option 1. Should have 3 pages of option 1 and 3 pages of option 2. They're very similar, but very different. So if you look at option 1, let me get option 1 back up here. This option 1 that Seth came up with was to take this $100,000 decrease and spread it equally to all classes based on percent of the revenue. So we had this is 2019 numbers. That's what he had to work with. So we had $16 million revenue. Residential represented 29% of revenue. Small commercial, GSA 1 is 11, GSA 2 is 29%, GSA 3 is 31%. And again, that's percentage of total revenue, and we're going to reduce that just in kilowatt hour charge on it. And you see over here on the rate decrease, 29% of 100,000 is 29,000, 11% is 11,000. Not exactly when you run through the numbers, but close enough. On the far right-hand column, you see the average monthly bill decrease. And so if we're going to reduce, let's take residential for example, reduce their total annual bill by $29,220, well, that's spread across 3,729 ratepayers for 12 months. So if you look at the formula, it's just strictly saying, I'm going to take that amount and divide it by number of customers times 12. And so what you'll see under option 1 is for a normal residential customer, about a 65 cent a month decrease in their bill. For GSA 1, that's the mom and pop shops, the small strip mall shops, things like that. See $1.13. GSA 2s, that'd be like Walmart, Home Depot, the hospital, $20. And GSA 3, Charms, Delfield, the big companies. This doesn't include Unilever, just our 9 big companies. About a $284 a month bill. So if we go to the next page behind option 1, this is our rate roadmap that we're used to looking at. Let me pull it up here on the big board. Get back to option 1. Okay. Going up some. So what you're seeing here, if you look in the blue columns in the middle of the option 1, Seth has reduced only the kilowatt hour charge for each class. So on the residential charge, you see him reducing 6 10,000ths. Let's see, 10, 100, 6 10,000ths of a cent or dollar. GSA 1s and 2, GSA 1, 75 1,000ths, 59 for GSA 2s, 57 GSA 3. We didn't do anything to outdoor lighting because that's very nominal numbers. We just did this to what we call general service customers. And so you see at the bottom of the page, you add all that up, that's $99,935. Well, the next page, remember this is just taking out the kilowatt hour charge only. You go to the next page, you blow that up on the board here. He ran these numbers for all residential GSA 1, 2, and 3. And I just put the residential in here for y'all to look at. The numbers look relative across all things. So what you see here, if we just reduce kilowatt hour rates only across all customers evenly, if you look at the far left hand corner, I've got it highlighted up here. A summer bill right now, a person using 100 kilowatt hours is $34.11. Blow it up some more. There we go. If we did this option one rate decrease, that $34.11 bill in the summer is going to drop down to $34.05, which is 6 cents. And that's for somebody using 100 kilowatt hours. And that's a 0.2% rate decrease. If you look at the average usage, 1,098 kilowatt hours, it drops the bill from $111 down to $110.34, which is 66 cents, which is the 6% that we saw. Of course, you get up, we've got several customers up in the big usage. 5,000 kilowatt hour bill, $411 drops down to $408.65, which is 7% reduction. So if you just do the kilowatt hours adjustment only, then these people with low usage get a smaller percentage than those with a high usage. And I'm going to go back in a minute and compare those on a different spreadsheet that y'all have on the thing. So, let's look at option. Let's go to option 2. Option 2. In option 2, Seth looked at it and said, all right, what if we take and reduce so that all customers receive the exact same percentage at 0.6%. And the way you do that is by reducing the kilowatt hour charge plus your KW demand charge plus your customer charge. And so if you look at option 2, we see the same numbers, same number of customers, revenue, percentage. These numbers here, it does not change the monthly average reduction in residential, 65 cents. It doesn't change the monthly reduction in GSA 1s. Under option 2, the GSA 2s get a little bit more of a monthly break, and we'll compare these in just a minute. And GSA 3s get a little more, a little break. But there again, and we'll look at it in detail, but that's reducing the kilowatt hour charge, KW demand charge, and customer charge. So let's go to the second page of your handout. And you see your rate roadmap there, the center column. And it's on the board here. So he's saying on this option, we're going to reduce customer charge for residential by 16 cents. And we're going to reduce the energy charge by 45 10,000ths, which was 16 thousandths, wasn't it? 60. Anyway, GSA 1 reduces their customer charge, their kilowatt hour charge. GSA 2, customer charge, kilowatt hour charge, and then you get into demand charges. We're backing them up. GSA 2 is about 3 cents for the first 50 and 9 cents for anything above that. Same thing in GSA 3. And when you do all the math there, it turns out that the bottom right part of that page, you'll see the total adjustment is $100,292. So we're still looking at $100,000 number. So now let's go to page 3 of option 2. And I've got it on the board again. And again, we get to this point by reducing kilowatt hours, customer charge, and KW charge. So we see 100 kilowatt hours right now, summer bill is $34.11. Under option 2, the summer bill will go to $33.90, which is 21 cents. If you look at 1,098 usage customer, the $111 present bill drops to $110.35, which is still 65 cents. And then if you look at the 5,000 kilowatt hours, that $411 drops to $409, so that's about $3. But what's interesting, if you look down the right-hand column of the summer numbers, it's all minus 0.6%. So everybody gets the same percentage reduction under this. And so we got two options, 1 and 2. And that's the only difference. Like I say, if you look here, you see it's all 16 right here. I'm sorry, I wanted to highlight it. Option 1, it varied from -0.2 to -0.7 based on usage. And so to summarize these two studies, we'll look at the residential, for instance. High energy usage bills receive greater reduction under option 1. These are with existing rates based on usage. These are the rates under option 1. That's the amount of decrease. And these are the rates under option 2 with the amount of decrease. And so we got 2,533 customers that use this much or more. You see under option 1, their bill decreases 66 cents. Under option 2, it's 65 cents. As you keep going up in usage, option 1 presents a greater reduction. So like the high usage, option 1 is $3, option 2 is $2.41. We've got 1,345 customers that fall in this range here, less than 1,000. And they get a greater reduction under option 2. So looking at this, and again, majority of our customers benefit from option 1, and those who have the hardest time paying typically live up here in this area up here. 1,500, 2,000, the houses aren't insulated and so forth. So I talked to Seth quite a while about this after I had time to go over his numbers. And he and I both agree that option 1 is a better option for a couple reasons. One is it helps the majority of our residential payers, option 1 does, compared to option 2. And we can go back and look at the small, commercial, large if you want to. It's going to fall out that same. The second thing, if we do option 2, we're going to start backing up on our last 5 years of rate roadmap. We start getting back into taking away the customer charge and the demand increase. And so neither he nor I want to go back and undo that. We hope y'all agree with that.
We're defeating the purpose of
Spending all that money.
That's right.
what we've been doing, trying to up the customer charge.
That's
Right.
If we
That's right.
include it in the reduction.
And it's, there's 15 other ways to look at this, but these are the two most practical. Now, the two he presented, option 1, in my opinion and his opinion, is the one we really, if we're going to do something, we need to follow option 1. Now, we can't do it this year because the rates will have been set in. I only got them back last week approved TDA. We'll look at this and maybe do 150 next year, who knows? But if y'all want to, when we do next year's rate study, we'll give him $100,000, $150,000, or whatever. Roll this in using option 1. If that's
That'd be my
y'all's-
suggestion. I mean,
Okay.
no sense in backing up what we've already done, and if it's gonna help the most of our residential customers anyway.
It is.
Might as
Mary, you
well.
had a question?
We're doing these rate reductions because we had too much revenue.
Because we had too much cash.
That's what I'm saying, too much cash. Okay. Then help this person that's not an accountant. When you do all of this over the last, isn't the cash the same?
No, our income is going to be reduced by $100,000. Therefore, our cash will reduce by $100,000.
And how much did we need to reduce it by?
About $1 million.
Okay.
Oh,
Well, but of course, you weren't here at the last meeting. You were on the phone, but you couldn't see. We can't, if you look at our monthly our annual TV reports, monthly reports, there's been a few years we've been in the red. And TV don't like that. And normally we make anywhere from $100,000 to $200,000 positive annually. So if we take $100,000 out of that 200 we make, it still leaves, we're still in the black. But if we take $500,000 out, all of our black numbers for every year since 19.
So we're doing this over a period of time rather than
Well, this will be starting next October.
Okay. But so what it says here on total, current total revenue, new total revenue, does not have anything to do with the cash.
All right.
Because that's only $29,000 difference.
That's
You're
just
looking
for
at-
residential.
That's for residential.
Oh,
Only for
That's for residential.
residential only.
Right, not now the new
Okay.
drivers.
That's
That's just a
fine,
small
I'm just looking
portion.
at when it says.
I'm sorry. Let me go back over here right quick and look at one thing. If you look at the rate roadmap, you see the number at the bottom, the blue.
Oh, option one.
Yeah, it's 99,000 right there.
Nine, okay, all right, good, okay. That's all, I just
Okay.
didn't.
Now, you know, we agreed, we're gonna try to finish up our SCADA this year and do some things with polling stations, change that out
We're
over the
gonna
next
use
3
that as part
years.
of that reduction.
We're gonna
Okay.
try to get it down with that.
Okay,
But as Keith pointed out last month, you know, next year we're gonna add $500,000 to it, next year 500,000.
mhm,
And I'm fixing to talk about this COVID-19 thing, TV will give us wholesale reduction. It's gonna add another $150,000 to it.
okay, that
Yeah.
was,
Yeah, I'm sorry, confused with that, but yeah, it's 100,000. And when we get to this discussion next year, we may well do more. I mean, it's up to y'all. We'll look at the numbers again and see where we're at. You know, my only reason we didn't jump full gun and say 500,000 this year, it put all of our earnings every year in the red, and TV will come in and slap us for that.
okay.
And have they ever gone in and took a utility over
Yes.
because they weren't doing what they're supposed to? You said, all right.
I can see that.
Yeah.
And, well, a lot of it happened, most of it happened when, we had to do the pension stuff.
Mhm.
That's what drove a lot of it, were ones that were not paying their pension money.
Right, yes.
Tim, I don't know whether it's time to bring it up, but I had wanted to ask you about looking at it anyway, but on our retirement plan,
Mhm.
I'd like to look at, you know where we had the, unfunded amount? When we were looking at the retirement plan.
Okay.
The unfunded number. I'd like to know what it grew in the last calendar year.
I'm about to go back and find an unfunded number. You know what, can you recall what you're talking about?
It'll be on the report.
Okay, let us look at that, we'll come back.
You know what I'm talking about?
Yeah, that changed when we put that $1.5 million in
And the
there, right?
next question is, like we're talking about, that was, you know, I thought that was an excellent idea,
Wasn't it?
to dump the, and I just wondered if TVA kicked if we dumped some more.
They tell us we can do whatever we want to that money, so we asked them specifically, when the $1.5 million said, no, do what you want to.
Well, I'd just like to look at that,
Okay,
how much we're growing in that unfunded commitment every year, even though we had to inject about twice what we were planning on, from 24,000 to 77,000 or something.
went from 24 to
And
46.
see still how we're running,
Right.
you
Okay.
know.
Let us bring that back, make a note, bring it back. I want to talk about our funds tonight. I didn't get the numbers late today. We're doing extremely well. I'm gonna just briefly go over them. And I've got to turn the air down. It turns off automatically.
Yeah, it is. It's not really warm.
That was me drinking
I figured it was the math.
No, it's not the coffee.
I just figured it was the math, I had it on.
Well, they do make you
Circulation.
hot too.
This room gets extremely hot in the wintertime, with damper turn one way. If we leave it that way, it gets extremely cold in the summertime. So we try to reach a happy medium, and I can't reach it. And I'm tired of calling this season back to that corner to change it. I wish I had a damper control down here.
But Tim, where I was coming from, you know, we're looking at a rate reduction. Another way, because TVA is telling us, I thought we'd look at all the options we had. Same point you bring is if we reduce how hard it is to go back up. And if you're prepaying like into the retirement fund, you're just gonna start getting that cash back. You know what I'm talking about?
You get it back and increasing your equity, let it grow, and also you're not paying as much cash each year towards the amount they tell us to pay out. We went from $150,000 3 years ago to 26,000.
Yeah.
And then when they came out with the new numbers, when the actuary did, it's when COVID hit, and so he bumped it up some, 46. But we're looking at a minute, we're recovered everything from COVID and still going up. We'll look at those numbers just a minute. But yeah, we'll look at that, get an answer for you over that. Make sure you understand exactly what you want to hear, see. We'll talk about, and while we're talking about that, well, when I talk about these regional investments, we need to see if we want Hall to come up anytime soon. Hall and Chris.
Okay.
Chris.
Chris.
Oh, yeah.
Hey, Doc.
We got you spaced out if you don't wear your mask.
I'm asked away.
That's fine, we got you spaced out. Okay, yeah, but we'll talk a little bit more about it in just a minute. I waited till Jim got here before we talk about our investments.
All
You'll be pleased with it. All right, so I'll tell Seth that when he does next year's cost of service, we're gonna do a rate reduction of 100,000 or maybe more. So he'll be prepared to play with the numbers.
right.
Okay. So, and Jim, what we just talked about was, the rate reductions, and you had the information in your packet, the board agreed to go with option one. Did we take a motion on that?
No.
Did we get a motion on the financials? We did, didn't we?
Yes.
All right, so I guess I need a motion
Motion on
to
selecting option one.
option one, yes.
So moved.
Motion by CH and second by Ms. Mary again. All in favor say aye.
Aye.
Done deal.
Okay, the next item, and none of this is more information, but for some reason I put it in the action items. Penny and I sat through last Thursday the monthly Western District Manager meeting. We have to do it over telephone now. And she sat in because,
COVID. Talked about
what's the
COVID.
guy, Sean Liddy,
Oh, Sean
our
Liddy.
attorney, our labor HR attorney that does work for all the West Tennessee utilities. He had about an hour and a half presentation on COVID care, or the CARES Act. So Penny sat in there. One thing that they talked about Thursday was that TVA staff is taking the TVA board for discussion September, the next board meeting in September. The concept of a COVID-19 pandemic wholesale bill credit that will be applied to all the LPCs beginning October 1 of this year through September 30 of next year, which is their next fiscal year. And they've got in mind of asking the TVA board to allow TVA to reduce our wholesale costs 2.5%. Now the details ain't worked out yet. The TVA board may say, we're not gonna do any of it, we do 3%, we do 1%, or some part of that. But, so they're taking that concept to the TVA board. And I don't know if they're doing that to try to appease MLG&W or what. But basically, we took that 3.1% reduction because we signed that long-term commitment. And that helped a lot. And if this is a 2.5% reduction, it doesn't apply to the total rate, just the base rate. And you gotta take out hydro credits and monthly fuel costs and so. But I did some basic calculations, adjusting what I thought. And I figured if they do a 2.5%, then next year we'll accumulate $150,000 to $200,000 more in cash. Because our wholesale costs went down. Now, it could be nothing, it could be 50, it could be 300. I won't know until the board approves it and we get the final formulas in, and Seth will run the numbers for me and tell me how it looks, and I'll report back to you over that.
What kind of restrictions they'll have on what we can do with that money?
Nothing,
Just,
nothing. It's just, they just reducing wholesale costs. Do anything.
Were we eligible for the PPE money? You know what I'm talking about?
Yeah,
Payroll protection plan.
Yeah.
well, no, we weren't. We weren't.
you,
When you say PPE, I mean personal protective equipment.
PPP,
Yeah, I
payroll
mean,
protection,
yeah, we weren't, so we didn't have anybody laid off or anything.
don't matter.
It didn't matter,
no,
you didn't have to.
But that's not the way I understood it.
you don't look at it,
Yeah.
it's,
It's gonna be free money if you can show that you used it to pay payroll.
You just
And it doesn't matter if
have
you've
to
got the money or not, as long as you
taxes.
can show that you used it.
Yeah, I got it.
I got
I didn't,
We
I
don't
was
need
afraid
any
to
money.
get it.
We don't need any money.
I was afraid to get the tax, because I didn't know what the forgiveness
We need
was
to
gonna
get rid of
be.
them.
Forgiveness.
Put it in savings, draw a little interest on it, you go.
Yeah, true.
Alright, if in fact it does, I didn't read that into it, it's my fault.
Well,
We'll look at that.
it's not too late, but
Yeah, it's not
it's
too late.
approaching getting too
Make
late.
a note, let's jump on that tomorrow.
Yeah,
We don't need.
but we're trying to get rid of cash.
Yeah.
But I say Keith's point, we can get it, we done in the retirement.
Exactly, we,
That's right.
when Uncle Sam's giving it to us, let's take it.
I,
There was also some part of the grant money that's what's available, I know for nonprofits. And right now, they're trying to decide if you got PPP and grant, whether they're gonna, one, you have to pay the difference in the grant back. But now they're talking about forgiving it all.
And on these loans, Tim, they charge 1%
Yeah.
until you get the forgiveness,
Mhm.
but the bank has already started getting in. They made it real simple and they're gonna forgive
From a 6 page
everybody.
to a 1 page
Yeah, and one
application.
page for the
Mhm.
forgiveness.
well,
Very simple process to get a bunch of money.
I apologize, I didn't realize that, I didn't read that part to it.
And that has no effect on anything that you're doing operational, you know, your income coming in, it doesn't.
But see, that's what I was reading, we were laying people off, we lost income,
Mm-mm.
that kind of stuff, and so I didn't think it applied to us. My fault. Yeah, let's jump on that tomorrow, Kathy, with you. Thanks for looking at us, I did not, my fault. Anyway, so we might have $150,000 more next year that we must figure out what to do with. And we can look at it next year, in fact, the board approves this. All right, the last thing on the action, any questions about the pandemic credit? Again, it's the wholesale credit.
This probably is a pandemic or wholesale credits or anything, but just because we have determined that some of the, lack of a better word, excess is gonna be used to update SCADA and get it really, are we working on that or is
Yeah.
anything taking place?
Well, the guys from Osmos are gonna do a pole line inspection, will be here in the next couple of weeks, they didn't get scheduled. And Terry and Harold have been working many days in the substation trying to get our data links back up.
Okay, I didn't know if we started or if there's
Yeah.
a hole on that.
Well, we've been started and working on it,
Yeah.
these ain't working very fast.
Okay.
Wednesday, I've got a meeting with Stan and Ricky and Mark from Christian Arnold, official kickoff, re-kickoff, re-kickoff. I told Stan, we're gonna get it done, I'm gonna find somebody else to be consultants. So,
I know it's a long process, but you know, that's one of those things that you don't,
it is, I mean, you say every year I carry 75,000 in the budget
right.
for materials and stuff, and just hadn't.
And then you talked about technologies and getting it on.
By the way, his internet went out Friday, including that, and our phone went out.
Did it?
And we got voice over IP. Y'all have voice over IP? I know David does, but I called in and all this stuff.
Was it totally out?
It was out in all of Tippah County that's served by Comcast, and so
Oh,
it's
okay.
about 12:30. I was at the front desk, and the lights blinked twice, real quick, in a few minutes, a few seconds, blinked again. Well, Evan came out and said, phones are down, because they run off computer.
Mm-hmm.
Now, we do have a way of bypassing. Penny was off Friday, her scheduled day off. I called her, and she's able to program her cell phone, her personal cell phone, and she answered the phone for us. And Terry can do the same thing with her smartphone. So Penny answered the phone with 2 or 3 hours, 4 hours, whatever, to closing time, from lunch to closing time. And we didn't have any outages, people calling about the bills. But everybody in town was out, so when I saw the blinks and I heard that the internet was down, I called TVA Dispatch because they've been replacing their overhead static wires on the transmission lines with new conductor that has dark fiber. And I thought maybe Comcast leased dark fiber. And I thought lightning's hit a structure, burnt down a strand, static wire, and that's the reason we're out. Dispatch said, no, they didn't see anything in West Tennessee as far as breaker operation. Of course, they're in Chattanooga looking at their SCADA system. They said the digital fault recorder in this substation did pick up because something downline from it had operated. Well, I knew it wasn't us, we didn't have any outages, so I called Southwest and asked Clint Malone, he's at lunch, I called him and said, y'all got any outages? He said, I said on the 69 to Henning or Mason, he said, no, we did lose a breaker about that time coming out of Mason. Turned out that the tree on Highway 70 fell through their three-phase and tore down 2 poles, several spans of cross arms, and apparently cut the fiber. Because that line feeds up 70 from Mason, feeds up front of my house into town. That's the reason it was out all night. I guess it took about long Southwest to clear up, and then for them to come in and splice. So if anybody asks, that's pretty good. I don't know what time it came back on. I know it was out Saturday morning, so I saw Evelyn at Walmart at 7, and she was still out of her house.
I got you first, and we never missed a beat that I know of.
Really? It's everybody trusts me.
So
Anyway, that's-
do you feel like you need a backup plan on the telephone there?
Well, that's the only backup available is that these smartphones. Otherwise, we have to release a hard line from AT&T. And I don't know if we can port those numbers back to AT&T or not during emergency. A hard copper line. But if that hard copper line is on the same pole Comcast fiber's on, it's the same.
As long as they can get it to roll over to cell phones, we should be all
Well,
right.
I got the hard line and I never did lose phone.
Yeah, AT&T.
Mm-hmm.
Yeah, yeah. The city didn't either. But if AT&T had been on that same line that Comcast was on, and tree fell through, yeah.
I don't know, because we have a Comcast, but I never used the hard line, so it never even occurred to me to see it, but.
And I don't know if we're limited, Keith, on how many phones we can have answering. I mean, I hate to ask the ladies to use their personal smartphones.
Mm-hmm.
There's only 3 smartphones, me, Will, and Terry have smartphones. We get SCADA done, I mean, we just bought new iPad 11s, whatever, after 8 years. I may get substation form in one, once we get SCADA talking again. But Penny's uses her personal phone, Terry uses her company phone. I don't know if we leave 2 people answering the phone, we have 10 people answering the phone. What they do, when a call comes in, it goes to the cloud, whatever the word the cloud is, it lives in the cloud till we pick up the phone here. Well, if you can't pick up the phone, you can get on your smartphone and call the cloud.
Mm-hmm.
And that's how the magic works. Now, I'm not an IT person,
I don't trust the cloud.
Well, internet purposes, and this may be totally stupid. But if the phone was working, if you had other than Comcast service, and your phone was working, could you do a hotspot and get it for your computer to work?
You asked me a question I can't answer.
Okay.
Well, hardly ever does this happen.
It's twice that I know of since we
No,
had
I
these.
don't think it's a big
It's
deal.
not.
As long as we have 2 or 3 people have cell phones, then I don't think it's a big deal.
And it's, our billing computer never went down.
Okay.
We was able to
That's
serve
what
our
I was-
customers,
Yeah,
but we couldn't get on the internet.
okay.
Well, we could on our smartphones.
But the building never went
But your
down. I was
internet was
thinking
fine,
more in terms of, hotspot for those.
Right. No, if our, now our CSA internet has gone down before, but we've got hard ledgers, don't we? They can pull out a rack and wait on people. Well, they may look at a number that it may not be up to date, but it's going to be close. But if we had a major ice storm that completely wiped out all communications, we'd be hurt. I mean, the 2 phones we have, or the 3 or how many we can get on the cloud with, would let us get there. But even AT&T would be tore down there in an ice storm.
We need to get our SCADA going again.
We're in
just
the
a
process.
waste.
Yeah, we're in the process. That's a work in progress. Okay, any other questions about that? Okay. Again, that's information item. The last thing I want to talk about is update on COVID-19. Kind of what we've been doing and where we're at. And I didn't put this data in your folders because I didn't have all the data till late Friday today. It's updates from Delta and the church. Okay, remember we stopped cutting off in April and May. From that time we didn't cut off, and then we started cutting back off again. We have a total of 38 customers who signed repayment agreements. And so far, everybody's paid what they're supposed to, the current bill plus the repayment agreement. There ain't any problems yet. When we cut off A cycle, the first time, we cut A twice and B twice. First time we cut A cycle, after a month, we still had 12 accounts that never repaid. They basically left, went southwest somewhere else. Well, after about a month, these idle accounts that cut off non-pay, we finalized those. And if the bill's $200, we take it out of the $300 deposit and then send them $100 back to the last known address. So those 12 accounts on A cycle that were disconnected in June because they didn't pay, 10 of them was covered entirely by the $300 deposit. So we lost nothing off those 10. 2 of the accounts, those 12, exceeded $300, but between the 2 of them, all we went to write off was $150.
Pretty good.
Which is really good. That's supply. I figured we were talking about $30,000 to $40,000 time we got the end of COVID-19. We hadn't got there yet. But on A cycle, I hadn't seen the second A cycle yet. We ain't cut them off yet. Finalized them. On B cycle, cut them first time. 30 days later, we still had 5 accounts that hadn't paid them. Well, 4 of them just moved off. But we had deposits cover them. The only one that we didn't have a deposit on, well, a cash deposit, that didn't pay as an apartment over at Sunrise. Now, some of those apartments are left in Sunrise name and people live in. And some of them, the customer gets in their name. Why Sunrise allows that, I don't know. We've got a $25,000 surety bond or letter of credit one on Sunrise. In total, to cover 15 apartments. We don't use our bond to pay past due bills unless they find that. So what we do with this $226 that Sunrise hasn't paid, we've contacted them, told them they need to pay it before that cutoff. If they don't, we'll transfer that to their office account and cut the office off, then they come back. And so hopefully all we're going to lose out of this first set of finalizing services, $150.
But if we only lost 376, I'd still say we were doing good.
That's great.
I'd still say we were
Yeah,
doing good.
that's good.
We'll see what happens in the next month when we do the finalizing on A and B again, after 30 days. But I'm tickled to death with those numbers. The staff did a good job putting this whole thing together, seeing that the paperwork was done, documented. I just can't say enough for all the ladies who made this happen.
The repayment agreement was good. Like I said, we
Yeah,
adopted
you
the city.
verbatim.
Yeah, verbatim. It was fantastic.
Same amount too, though the bills are half on ours. Y'all got your money back faster. Okay, last month, the LIHEAP money that goes to Delta, that low income energy assistance, they increased from $500 from customer to $875. LIHEAP got more money through the COVID-19 funding from the federal government. And so it was, you got $350 or $500 depending on circumstances, how you qualified. And now they can get up to $875 with this COVID stuff. Now to date, Delta has awarded $44,750 in total assistance this year. Normally this time of year, without COVID, they normally awarded about $30,000 to $35,000. So that amount, I'd say maybe $10,000, $12,000, that $44,000 probably was due to COVID stuff. And when people, they're allowed to apply one time a year, once every 12 months. And then it's decided by the Delta staff, they get the, it's 350, 500, now 875, is that how it works?
Sounds right.
Okay. And once they get that allotment, they can't apply again for 12 months, so I understand. So, you know, Delta gives us money every month all year long, depending on who applies for it. So I said that 44,000, probably 12,000 was direct relationship to COVID hardships, and the rest of it was just people who normally ask for it. To date, First United Methodist Church has awarded $9,023 in community care funds. That's that 20,000 that we funded, we and TVA funded. So they've given $9,023 for people who qualified for the COVID Community Cares Fund. In addition, they've awarded $4,565 on Roundup programs, an additional $4,505 in assistance from their Samaritan program. What is the Samaritan program? Is that food bank and things like that?
Well, no, it's just, somebody comes in and asks, and, I just got kicked out of my house, I don't have anywhere to take my kids, and the Good Samaritan Fund will put them up in the hotel, or it'll help buy my bus ticket home, or something like that, so it's
Okay.
just a general help fund.
I was gonna say, most of the time, what monies they give here is like $50.
For the Samaritan?
Yeah, they'll help out on the bill, but they usually
Right,
don't
it'll be
pay it all.
$50, it won't be, yeah, it won't be the whole.
Well, and I didn't realize that. So there's 81, it's $4,500 in the Samaritan program. I thought it probably came to us.
Well, it does, it $50 here, $50 there.
It's not community cares.
No.
Okay.
Mm-mm.
So
They don't
basically,
qualify for that.
today they pay out 9,000 of the 20,000 in cares fund, and they've paid another 9,000 from Roundup and Samaritan program. So they pitched in 18,000 so far.
That's awesome.
It is, and you know, I thank Liz and Sandy all the time, 'cause, she finally sent the email back to me this morning with the numbers, with no attachment. I said, I don't see the attachment. She says, the door's been busy today. So she said, I'm sorry, here it is. So anyway, that's where we're at with that. Any questions about the CARES fund or the light money, anything like that? Both of them have helped our customers out really well. Again, Huffman did pass the countywide mask mandate if you can't maintain 6-foot spacing. You put signs on the front door, no one's complained about it. All employees at the front counter wear a mask. When the customer comes in, they may not have it on or pulled down if nobody's standing in the line. And if it's come to my office or Kathy's, we may have ours on, unless we have to get together. So.
Tim, are you purchasing the masks for your staff?
We
And you have
do.
those available for
We've got one.
anyone that come in? Do you do mask sanitizers, wipes, spray, all of that for the staff?
Yeah. Sure.
Do you have a thermometer, or did you do the thermometer?
Electronic thermometer.
Okay.
Digital.
Digital, yeah, the infrared.
Shoot. And it seems to be accurate. Compares to mine and mine.
Yeah, they work pretty good.
A lot of employees wear their own mask. We don't buy them $20 masks.
Well, these were ones that actually we did buy these.
Yeah.
But this was like a $5 mask. When they first did it, somebody made them, and yeah, we did
I
like
got
$5
this one
a
from Stanley
mask.
Scott at Mother
I just
Nature's
didn't know whether,
Health.
you had them available
We do.
for the staff.
Hand
Or
cleaner,
had-
wipes.
Had
Gloves.
problems getting them.
Well, early on, we had problems getting the wipes and the sanitizer.
You
Everyone-
can't find Lysol.
Gloves,
No.
yeah, anytime we,
Can't find what?
Lysol
Lysol
spray.
spray.
You
Not
can't find,
Lysol brand, yeah.
but you can't find the generic
Clorox
one.
wipes. All right, so what Evelyn's been doing, before she comes to work every morning, she runs to Walmart, open up, then she goes back there and reads. Now, as a business, we get 3, I think.
So if you go early enough to Walmart,
Well, it's all on who you know too,
Oh,
because
I
we
was
do,
ready to say now.
we
I got a
do
buddy
have
that's-
people that will call and say, we're about to restock, you better come, we only have so many, and sometimes we get some and sometimes we don't. And Sheila Watkins that cleans for us, whenever she comes across any, she'll grab some too.
So we're in pretty good shape right now. Okay, the next thing is, that I want to talk about, just an update, is the CARES Act itself. Like I say, Penny and I sit through that hour-long presentation that Sean Lilly gave last Thursday. Real good information. Then all the managers had a big discussion about what they were doing, how they were dealing with the CARES Act, pay, and whatever else. So I'll go back and revisit a couple of things and get the board's possible approval on that to continue doing what we've been doing. You remember Governor Lee, 3 months ago, did the state of emergency. That's when we shut the office down. And we let all of our staff, except me, went to working 2 days and off 3 days, and next week work 3 days and off 2 days. We did that for 2 months, so they wouldn't have employee-to-employee contact. And again, since I was able to quarantine pretty much in my office, I worked every day. Get back up there. I was here every day in case somebody needed something, whatever. Except I did take 2 days vacation to get the yard ready. When we did return to our normal staff at the end of May, during that 2 months we was working half-staff, the 17 employees were half-staff days, that totaled 2,890 hours that we paid them to stay home and standby. So I had 3,000 hours. And it was a good thing we've not had any outbreaks here at the office, hopefully because of that, the fact that we were distanced. And there's been a few utilities that found out it's had 5 cases internal. It's causing them hardships. Now early on also, I think in March, we talked about this CARES Act that the government passed and talked about additional paid time off for emergency sick leave and emergency family medical leave. I think it was 80 hours of sick leave and 400 hours of FMLA. For COVID-related reasons, either you're quarantined, you're sick quarantine, you're taking care of someone who's sick quarantine, or the 400 hours is for the people that had kids in school that couldn't go because they shut school down. Daycare was shut down, school shut down, and they had to take off to take care of the kids. And we'll talk in a minute about how our employees have dealt with that. But, we decided back then that since the majority of any time missed was covered, mandated to be paid for by the CARES Act, that we go ahead and keep our employees whole, unless it got out of hand, and it hasn't. So, as it stands today, if somebody has to be off because they're quarantined, like Bill Cook was for 2 weeks, then the CARES Act covered all of his sick time. And if somebody would be off earlier because the kids could go to school, CARES Act covered 2/3 of it, we covered 1/3 of it. And we've been doing that. And that's what the majority of all the distributors in West Tennessee have done. They kept their employees whole. Now, as for our last pay period, we've had 4 employees who had to miss work to care for school-aged children because school was not in. And there's just a couple of days, couple of them just part of a couple of days. Total 83 hours. 75 hours of that was mandated by the CARES Act, we had to pay for them. And the other 8 hours we covered to keep them home. We've had 2 employees who had to quarantine because they were in contact with someone who had tested positive. And those 2 employees had to quarantine. But the way that the thing says, if Ginger gets sick and gets tested positive, she has to stay quarantined for 10 days after the onset of her illness. And at the minimum of 10 days. Now, on day 4, she could feel better. And after you've gone 24 hours, they say that the virus has run its course in you. You still got to be off full 10 days isolation. Now, on day 9, if she's feeling better, she goes 24 hours without symptoms. Then after day 10, she come back to work. If she has symptoms on day 10 or 11 or 12, she can't come back to work leave quarantine until she's been 24 hours without symptoms. So let's say she got sick and tested positive. Well, of course, since I'm a household, there's difference between household members and non-household. Since I'm with her every day, if she got sick, I would have to quarantine with her. And then once she gets to feeling better for 24 hours, I have to quarantine another 14 days. That's the way it's, am I saying that right? What are you
I
gonna
don't
do?
think so.
What,
I don't think you have to take all the money. That's not what, no, I think that if she, from what I understand, what we are doing, if she tested positive,
mm-hmm,
then you can be quarantined. And then when she tests her negative after 14 days, then you should be able to get a test and you should be positive or negative and get your results back within a couple of days.
mm-hmm.
But we have never had anyone had to stay off for a month. I mean, that's not, I mean, that might be.
That's not what the Tennessee Department of Health says.
Well, that's not what, I mean, that's what.
Now, medical can do different. Medical falls under a different
Okay,
headline.
but I just, a month.
Kathy, you've read the same thing. Am I, we wrong about that?
That's what we interpreted the information to be.
A month is a long time to be off.
Of course it
is.
is.
If you're not.
Of course it
positive.
is. Of course it is.
See, I thought if you had someone in your household, then you had to separate and quarantine for 14 days. And if you had no symptoms at those 14 days, and your temperature was normal, you could return back.
I mean, you're not supposed to stay right there.
Right, you're
with
not
her.
supposed to stay there.
Right.
She's supposed to quarantine.
Right.
Or you're
Right.
supposed to quarantine, you're supposed to go somewhere else, and that's why people are having to go, leave their homes, because you're not supposed to be staying there with her.
Okay.
You're supposed to go get tested.
That's right,
Yeah, you're supposed to go get tested. If you're negative,
Yeah.
then you quarantine for 14
That's right.
days.
You
No
get tested.
temperature, then you are able to.
And you don't wait till she's okay to go get tested, you go get tested.
As soon as it happens.
It's
Yeah,
like-
right, as soon as it happens.
All right. I can't bring it up. This thing won't let me do
And
that.
I mean, that's the way I'm.
That's what, yeah, I mean,
Let me go get something like that.
I had a patient who worked in intensive care back to 6.
Mhm.
She just felt bad. She went and got tested. She tested negative. Went to work. Still felt bad. 5 days later, she got what she couldn't breathe again.
Chest
Goes
is
to the
hot.
hospital. Put her on oxygen fluids and everything. Tested negative again.
Mhm.
Her husband goes and gets tested now. And it's like, what's going on? Well, he tests positive. So she's like, I don't know if I believe all this. She got better. She stayed home a week. Got tested for antibodies. Tested positive.
oh, wow. Mm-hmm.
So, it's who, where, when.
That's
Where
right.
we, and which kind of test you use.
That's right.
It's so much.
But no, Tim, I mean, if Ginger were to test positive,
Mhm.
you would automatically, right then, immediately, go get tested.
Mm-hmm.
And then you would quarantine. You would have to
We're
separate.
quarantined together, right?
No, no, quarantine
Well, in
together.
the same house we would.
You
My
really need
understanding
I'd be on
is
one
you're
side,
not
she'd be on
supposed to
the
be
other.
near her.
Do what?
You're not supposed to be near her, is my understanding. If she's positive, you are not supposed to come into contact with her.
She can stay in the bedroom, you put food, but you cannot come in contact with her.
Y'all tell me something that is not what the CDC is advocating.
So that's why the hospital and the
So-
concern is doing it.
Yeah, and it
I
could
mean,
be.
that's
Right.
what we are told, but you have to get tested. You don't wait.
Yeah, no, you get tested. You get tested
Until
now.
after she gets tested. You don't wait for 2 weeks to get tested. You go get tested if she's positive.
Correct. And if I'm negative, I've still got to wait until she gets over her symptoms before, because she could be positive until day 8 and get over symptoms. Because I'm in the same household again, household contacts and non-household are treated differently.
That's why you need quarantine.
So who's supposed to care for your spouse when they're sick at home with COVID-19?
Tim, that's the whole issue with COVID-19. You have nobody to care for you.
Well, if she's that sick, she's probably in the hospital.
And they're in the
No.
hospital, yeah, if they're like that, they're in the hospital.
What if she tests positive, but she's not showing symptoms?
Well, then she should be
That's
taken
where
care
she
for.
can take care of
Take care
herself.
of herself.
All right, we'll do some more research. What I'm fixing to tell y'all is what Tennessee Department of Health says. As of July 29th, because I was going to pull it up, but I can't. Not being able to pull it up. So based on what they said and what the CDC says, and we are essential workers, this is what I've told the employees. What you must do if you're in close contact with someone that tests positive for COVID-19. Close contact means by CDC, the Tennessee Department of Health, living in the same household of a person diagnosed with COVID-19, caring for a person diagnosed with COVID-19, being within 6 foot for more than 10 minutes of a person when you or they are not wearing a mask. And being in direct contact with secretions from a sick person and you're not wearing a mask, such as sharing a fork or kissing someone getting out or whatever. That's the 4 things that out of the CDC and the Tennessee Department of Health as of
You're
July.
not really sure for people. What do you call it?
Well, 3 things, man. And so that's what they say, that's how they define close contact. So if you're in close contact with someone who ends up being tested positive for COVID-19, then you must stay home for 14 days after your last close contact with the person tested positive. You got 9 household contacts, household contacts. A non-household contact, if that person tests positive, whether it's symptomatic or asymptomatic, non-household contacts must be quarantined for 14 days from the date of last close contact with the person who tested positive. And that's what Tennessee Department of Health says. That's
So
what
where's the other 2 weeks coming in? Where you say a month, they need another 2 weeks then.
household contacts.
But it said, you read it, that it said you must be quarantined for 14 days. It didn't say,
No.
go back and look at the second person and until they reach in.
No, non-household contacts.
Now, we talking about household
No,
contacts.
household, let me read the household contacts. Household contacts must be quarantined for 14 days after the person with COVID-19 has been fever-free and feeling well for at least 24 hours.
They can actually be fever-free before the 14 days are up.
Right, and you would start counting when they're fever-free.
Right.
Right,
That's right.
right. So if Ginger got sick, she's fever-free on day 4 for 24 hours, I would start my 14-day count from there.
But then you're saying you take another 2 weeks.
Right.
That, he was just saying like if
If she
they
was off-
do the
Yeah,
whole,
if she was
still
sick
sick
for 2 weeks,
and doesn't
Right.
have 24-hour fever free,
I've got to go, any one of us who are around a household member who tests positive, whether it's symptomatic or not, if the household member tests positive, then we who live in the house with them, by the Tennessee Department of Health guidelines, you have to quarantine with them, and you have to remain quarantined for 14 days after they've been 24 hours without symptoms. Now, if Ginger had it, that's 24 hours in day 5, then I got 14 days. But if she's still sick through day 20, well, she's in the hospital by then. She's,
Yeah, she'd be in the hospital.
yeah, she'd been in the hospital, right?
Yeah, I thought you said I thought you said implying you'd automatically take a month off.
Oh, no.
Okay, that's what I understood you say.
Also, if you think you have COVID-19, we require employees to get tested. Cannot return to work until you have the results of the test. If your test results are negative, and you've not been in close contact with a COVID-19 patient, you can return to work.
Well, sure, better.
Right, and we've had several that just want to get tested, and now, when they first started testing, it was like 4 or 5 days to get results. Now they're getting back, what, 45 minutes, an hour?
Red
If
bed.
you do
Really,
it,
right,
yeah,
we've had
rapid
several
test.
employees went there, right.
So did they feel sick or they just want to be tested?
They just want to be tested. Well, 2 of them were exposed to someone who had it, so they had to be tested. And they both came back negative. But they had to be off till, well, one until 14 days after he was exposed to his non-household contact, and the other one, the child, tested positive. So she had to count 14 days after he'd been 24 hours symptom-free, which is like a day 4 or 5, whatever.
Can you get the results back in
30, 45
Yeah,
minutes.
Red Med down there in Toka,
We told them.
they can get it back.
They have a rapid test now that they're using.
Fast.
The health department, you get it back usually the next day, or the health department's gotten a lot faster too.
Yeah.
So the way that the regulations read is July 29th. If you get tested and the results are positive, you must be isolated for a minimum of 10 days after the onset of your symptoms. You can return to work after 10 days if you've been fever-free and feeling well for at least 24 hours. Now, if you're asymptomatic, you tested positive, you don't show any signs, you still have to quarantine for 10 days. Then that's 10 days is minimum. Then you come back to day 11. You never felt bad, so you're asymptomatic. And you don't have to get retested for COVID-19 after 10 days. They don't require a test anymore. Also, there's a specific note on the Department of Health and Welfare state, lingering cough will not prevent you from going back to work. So that lingering cough is not a symptom. That's,
No, because a lot of people have a lingering cough.
Yeah.
They're going to say they're going to have it for 6
Right.
months, to 9 months afterwards.
and so, I've given this to all the employees, and this is pretty much, during this conversation with all the managers last week, we all talked about most everybody's doing exactly like we're doing. And some of them wasn't sure, so I sent out that email right there, Tennessee recommended isolation quarantine to everybody in West Tennessee, so they have it too. But that's right off of their stuff there. So, having said all that, we're doing like most everybody else is doing. We'll make sure that if employees missing time for COVID-related reasons, what the federal government not paying for, we cover. And so far, it's been just piddling. Like, how many hours was it?
75.
They had
How many
85.
said one they're not paying for medically?
80 hours.
No, just time.
I said 85 earlier, and you said
85.
Like total.
we only had to cover like 8 or 10 or something.
Yeah,
Yeah,
wasn't
right.
even, yeah, wasn't
Right.
all.
So it ain't been much. There was 215 hours all total mandatory. They had to be off, either take care of kids or because they exposed to COVID-19. And 65 hours for 6 employees that wasn't covered. So it had cost them maybe $2,000. So, and again, we're doing like everybody else is doing, most everybody in West Tennessee. But I got to thinking, now the school started back. And if they had an uptick in cases, they could shut down school for 2 weeks, 3 weeks, whatever. Which would require, and again, I've got 4 employees that have used time off, a little time off.
Their time off?
No, COVID
time.
related time off. Because the schools were closed, daycare were closed. And for the most part, either the spouse is taking time, and they're swapping around, mother-in-law's helping, and so forth. And it really has not, them being off doesn't cost us anything except productivity, because we was gonna pay them anyway. So, now that school's starting back, thinking if we had an uptick and they cancel school 2 or 3 weeks, a month, whatever, we may incur some more of these costs.
How many do we have with school-age children?
Most, that's what,
Most of-
That's what your PPE.
I was getting ready to say, this is
That's
when
right.
PPP comes in.
okay.
That's where it is.
Yeah, Yeah, we need that then, if we think
Yeah.
that's gonna be a problem.
Well, hopefully it won't happen,
Mhm.
but I just wanna make sure that this board won't continue like we've been doing.
But you need to get, yeah, try to get that PPE.
Yeah, we will. As long as it's COVID related. I mean, if I have broke leg, I can't be off COVID related. But if you're out quarantining or taking care of kids or whatever the COVID related reasons, y'all still want to continue doing that, knowing the school started back. I hope you do.
If we have to.
Well, we don't have to. I mean, we have to give them time off, but we don't have to eat that little bit of cost that we've been eating like the other distributors do.
Well, I mean, how much PTO do they have? I mean, that's what we do, we start as take PTO.
Yeah. They've got varying amounts. Some got 20 hours, some got
Okay.
300 hours. But again, we've been doing it, but I wanted y'all to look at it again in case we did have a spike to make sure y'all still feel comfortable doing it, continue. You know, just like the rest of the utilities do. Now, I want to bring that up tonight before we did have
Oh,
a
yeah,
spike.
oh, yeah,
I mean, it's,
So we were off, that's when I used the PPE money.
well, and yeah, we'll look at that.
You were closed up for a while,
6 weeks.
and that money was just to keep those
Right.
salaries going as normal.
that's what it's for, and I mean, you shouldn't have to dip into your pockets to.
Right.
That's
They
why
didn't
they
have to dip into their pockets for annual leave, sick leave, or nothing. And it was a nice sum that you could get. I think it was 3 months worth of payroll, or, I can't remember how the calculations
We're
were.
gonna jump on that tomorrow, okay. So if y'all agree with that, I just want,
Well, why don't we look into the PPP, see what the PPP does, if you can get that.
okay. What if we have somebody off him before we get to next month's board meeting, keep doing like we're doing? I mean, we've been doing it.
I think if it's COVID related.
COVID
You
related.
would go
I
ahead
would
and,
say we have to.
Yeah.
I mean,
Okay, we'll just continue on like we've been doing. And like I said, most of the utilities in West Tennessee doing just like us, they're covering what little it's not covered. We'll look at that and bring it back at the next board meeting. I mean, if it's something obvious we can take up quickly, we'll go and apply for it and tell you the results by the next board meeting. Okay? All right, that was a lot of talk about this, but I want to make sure everybody knew where it was at, what we've actually experienced in-house, which has not been that bad. A lot of utilities have had some problems, people getting sick, the employees, and having to close down front offices and all kinds of stuff.
I had to stay home with the twins for 4 days, week before last, because more than 3 kids in their class had fever. And when you pull up in the morning, you've got your mask on and they're gunning you before you get out of the car. And so they had 3 that had fever, so they shut the whole class down for the rest of the week just to give it time. But they're isolating everybody in the classrooms. But and that's the only class that's been shut down since they've been back open. And none of it was COVID; they just were sick kids. But
And
just precautionary.
There'll be more and more of that. I mean, it's time for flu season to come on.
No, that's it.
Some more.
Flu season hopefully will be better, because people are being more careful, so we're hoping for it.
All right, the last thing.
Get your flu shot right away.
I'm ready. Just like that. At least it
Get it where?
we
Get
get
it
it.
right before Halloween.
oh, right.
That's kind of a good time.
Yes.
I see where it goes now.
Yeah, I was gonna go now. Why?
As soon as they come in October, as soon as they.
Is what, right now, right?
Oh, yeah, I mean, you know,
I'll
you
be
gotta
glad.
build up all the antibodies.
Simplify it, so they agree to keep on what we're doing. Okay, that's all the stuff I had on the action items. 2 quick things on information. The fuel costs just went down a little bit, $1.48 a month for September. I did pull up our regions statement today. I keep up with it every month. But just a quick summary on 2/29/20, before the COVID thing hit the stock market, we were at $5.3 million. $5,341,000. Valuation on 4/30, April 30th, was $4,750,000. Valuation today, $5,528,000. So we're $200,000 better today than we were on the high on February 29th, we're hit. And looking at when I compare what we do to the Dow, NASDAQ and all that, in July, just beat them all, hands down, so. But I say all that, normally about this time in the fall, we have Hall come in and talk about stuff, and the new lady, Chris, Dawn's not there anymore, the tall lady, she's gone. Chris took her place. Do we want to try to schedule them sometime in June? July?
October, right before the election.
October,
That's a good idea.
write it down.
I
What
like
if,
that.
what if, what if?
I like that, yeah.
Depends on which news channel you're watching. You write that down. Chris asked me the day if they could come, and I'll tell her. We'll work out the time. All righty, that's all I had. Does anybody got anything to discuss? Yes.
What about the cell phone line?
Well, it's sold. The ID board bought it. They got a
Yeah,
Tennessee
city and
grant.
the county and the ID board bought it.
Yeah, but what about for us? Are we able to furnish whatever?
Power, yeah. We can serve up to 8 megawatts there.
Okay.
No one has looked at it yet.
Well, I did.
Well, somebody looked at it, but they spurred us. That's the reason we bought it, is we had someone interested.
Yeah.
But it did pan out. But now that we got Mark Herbison working, I think it's going, if there's interest to be had, he'll find it.
Mark is getting all kind of grants and Tennessee TVA grants and State of Tennessee grants. They got to raise the soil 2 or 3 feet, 4 foot to get it out of the floodplain. That Fisher Farm across the road is in worse shape than this is as far as floodplain. They're going to try to get a rail spur in. And that's like a 16-foot drop off a rail line down to. So they're trying to acquire money to get infrastructure. When we rebuilt the circuit around Unilever 10 years ago, we pulled a special circuit just for that piece of property.
That's good.
The only thing that's on that special circuit now is that ecovation plant that takes care of all of their smelly waste, 50 kW, and then a little radio repeater tire up front. So,
That's good.
we can serve about 8 megawatts. And at that point, we're going to tap out our entire substation too, which means changing out transformers. We're building another substation. We're going to have firm capacity. Any other questions, comments?
All right, none that's come.
Move to adjourn.
Got a motion to adjourn, second by Jim, all in favor, let's go.
Hey, we'll stop on all.